Hi everybody, Helen Thompson here. Welcome to 2021. We all made it. Happy New Year. I hope everybody's doing well. I hope we all have a great year. So I'm back, and today we are starting with autoimmune diseases. So it's going to be a big day, and actually what I'm going to do, because there's over 100 autoimmune diseases, I picked out 25 to go over today that fibromyalgia mimics very closely their symptoms. So what I'm going to do is I'm going to do part one video right now, and then there's going to be a little box that you can click that's going to take you over to part two. I'm splitting it into two videos because it's just going to be too much to put into one video. So what is autoimmune? So first of all, fibromyalgia is not an autoimmune disease. We've pretty much determined that. The research has determined that. But you can have autoimmune diseases along with fibromyalgia. So an autoimmune disease is when your body's immune system creates antibodies to fight things that are foreign to your body, like bacteria or viruses. And what happens is either you have chronic inflammation or something that's not totally taken care of, and so your immune system gets confused about what it's supposed to be fighting, and it attacks your own tissues in your body, and it can affect all of the organs in your body. So as we go over these autoimmune diseases, hopefully you'll see how that works. The good news is that you can put your autoimmune into remission and have fewer flare-ups with your autoimmune, and I'll give you some hints on how to do that as we go along. And we're going to talk about vitamin D at the very end, because that is the big precursor to getting your autoimmunes in remission. All right, so let's get started. I'm going to start with rheumatoid arthritis, RA. What it does is it causes inflammation in the linings of the joints. So as a result, your joints get red, warm, swollen, and painful. So with fibromyalgia, we get the painful, but we don't get the red, warm, and swollen in our joints. And we definitely don't get the deformity that rheumatoid arthritis causes. So we can have, that symptom, but not have rheumatoid arthritis. RA is symmetrical, so it often affects the hands or the feet or any joints, but it affects both of them, not just one. And sometimes with fibromyalgia, we're just getting pain in joints on one hand at a time, or it moves around. With RA, it doesn't do that. It's always on both sides at the same time. It can also affect your eyes, your heart, your lungs, your skin, and your blood vessels. So what makes you susceptible to RA? Obesity, because it causes inflammation in your body, chronic inflammation, smoking. Children who had mothers who smoked have a double chance to get RA as adults. So what are the treatments for RA? Basically, all the treatments for all the autoimmune diseases are centered around decreasing the inflammation and supporting the immune system. So the way they do that is with steroids and anti-inflammatory medications, decreasing stress in your life. You really need to, if you're obese or overweight, you need to lose weight, because that causes chronic inflammation in your body, which can keep it flared up. Smoking is huge. It causes inflammation all over your body and causes a lot of these things to be worse. So what are your risks with RA? You can develop premature heart disease, high blood pressure, diabetes, and obesity makes it hard to get relief from the treatments because it's hard to get it to absorb into your system. So your pain, with fibromyalgia, our pain is coming from the nervous system. It's sending out pain signals to the area. It's not inflammation. I just want you to, I'm really gonna stress that today, because so many people out there, and there's a lot of misinformation. There's a lot of old information on the internet that is still stating that fibromyalgia is an autoimmune when that's already been disproven. Okay, so next is lupus. Lupus is an autoimmune that can attack anywhere in the body when it's inflamed or flared up. Your symptoms with lupus are achy joints, fevers over 100, swollen joints, fatigue, skin rashes, ankle swelling, pleurisy, butterfly rash on the face, which a lot of you sometimes get, and sometimes medications can cause that, but most of the time that's what's referred to as the lupus rash. Hair loss, sun sensitivity, seizures, mouth sores, Raynaud's can be caused from lupus, blisters and rashes, and swollen glands. So lupus also, what it does is it causes low red blood cell counts, low white blood cell counts, and increased platelet counts because it affects the kidneys. And so anemia can cause the fatigue. It can cause bruising easily due to your platelet count, and blood clots in your legs, your lungs, or it can cause a stroke. So drugs that can actually cause you to go into lupus are hydralazine and procainamide. Those are heart medications. So just look and see if you're on either one of those, because if you are and you have lupus, that may be part of a contributing factor that caused your lupus. So how they diagnose it is blood tests and skin biopsies. So with lupus and fibromyalgia, we get the achy joints, we get fatigue, we get, maybe the sun sensitivity, maybe the hair loss, just different kind of sporadic symptoms, but we don't have the defining symptoms, which is the butterfly rash and the mouth sores and things like that. So that's kind of how you determine. And our fevers with fibromyalgia typically are low-grade fevers, like 99 to 100, never over 100. So if your fevers are over 100, you have something else going on. So next is IBD, which is chronic inflammation of the digestive tract. It causes ulcerative colitis and Crohn's disease. The symptoms are diarrhea, fever, fatigue, abdominal pain, cramping, blood in your stool, and weight loss. Unfortunately, NSAIDs can cause this. So the anti-inflammatory drugs that you're taking to help your autoimmune can actually cause this autoimmune and make it worse for your digestive tract to be able to absorb the vitamins and the nutrients and the things that you need to help your autoimmune disease. So everybody talks about IBS. What is IBS? What is the difference between IBD and IBS? IBS is actually not a true disease. It's a functional disorder, and they don't know what causes it. It's not inflammatory. It's actually caused by stress. So the stress that probably caused your fibromyalgia is also causing your IBS. Okay, so IBD, which is an inflammatory bowel disease, is next. It's chronic inflammation of the digestive tract, and it causes ulcerative colitis and Crohn's disease. The symptoms, of course, are diarrhea, fever, fatigue, abdominal pain and cramping, blood in your stool, and weight loss. Unfortunately, the treatment for anti-inflammatory NSAIDs can also cause this to happen because those anti-inflammatories are really hard on your digestive tract and your whole gut and can cause ulcers and bleeding, and they're just not good to take long-term or high doses of. You can also, taking the NSAIDs, have an increased risk of colon cancer. It can cause bowel obstruction, toxic colon, and dehydration. The ulcerative colitis and Crohn's disease cause those. So the difference between inflammatory bowel disease and IBS, because with fibromyalgia, we have symptoms of this, but ours is caused by IBS, not the inflammatory state. So IBS is not a true disease, it's a functional disorder of the bowel. They don't know what the cause is, and it's not caused by inflammation. So most likely they believe that it's caused by stress, which kicks us from going from diarrhea to constipation, because we pretty much, go back and forth. Now medications can also cause you to go back and forth from constipation to diarrhea, depending on the medications that you're taking. So check your medication side effects, and if you're having a really hard time with either the diarrhea or the constipation, you might want to look at changing some of your medications. So what is the IBS treatments? Well, unfortunately, because it's not a disease itself and it's caused by stress, there's not any medication treatments that you can take for it. Basically, you need to just change your diet, diet of clean eating, and avoid fatty foods, and avoiding caffeine are the best ways that you can calm down your gut. And then, of course, taking the probiotics and things like that will help. So now we're on a big one, MS. So multiple sclerosis is your immune system attacking the myelin sheath, resulting in lesions. So the way MS is diagnosed is by an MRI, and they see the lesions in the brain that are actually created from the myelin sheath being attacked by the immune system. So with fibromyalgia, we also have issues with our myelin sheath being thinned or non-existent, but it's not being attacked like with MS, and so our nerves are not becoming exposed as roughly as they are with MS, and that's why MS can progress and become permanent and have more flare-ups and things like that, because the nerves are completely exposed and not covered any longer. So symptoms with MS: blurred vision or double vision, you get limb weakness, difficulty with coordination and balance, and it can impair your walking or standing ability, speech impediments, tremors, dizziness, bladder problems, to where your bladder may not function properly, so you either become incontinent or may need a catheter, and paralysis is the worst case scenario. And also you get electric shock sensations from MS. MS can cause permanent damage and deteriorate its deterioration of the nerves. So it happens more in women, 3 times more than in men. It can be caused by a virus like Epstein-Barr, low vitamin D levels, and smoking. And today you're going to see a lot of Epstein-Barr as some of the causes of these autoimmune diseases, because there's some confusion out there about whether Epstein-Barr virus is connected to fibromyalgia, and it is not connected to fibromyalgia. A lot of us who have fibromyalgia have never had Epstein-Barr virus or mono or anything like that. So it's not connected to fibromyalgia, but it has been connected to some autoimmune disorders as the cause. Treatments for multiple sclerosis: steroids and plasmapheresis. All the drugs that are the treatment for multiple sclerosis cause liver disease and liver damage. The best thing that you can do is get physical therapy, take muscle relaxers, get rest, decrease your stress, proper exercise, good diet. And when I get to the end of this section, I'm also going to tell you another way that you can decrease your autoimmune diseases and put them into remission. Diabetes type 1 is where your body attacks the cells of the pancreas that make insulin. And there's not much more to say about that, because we all know what that does to the body. Guillain-Barré is one that a lot of people who get vaccines can get this. It's a neurological disorder. It's your immune system attacking your nerve cells. And what it does is it starts with numbness and tingling in the extremities. And usually it leads to full body paralysis. And it usually starts in your feet, and it works its way up your body, up towards your chest, and then your arms, of course, are the last things. But it can cause you to not be able to feel yourself breathing, and you can end up on a tube and all of that. A lot of times the symptoms will get better and go away once whatever is causing the Guillain-Barré gets treated. They do plasmapheresis and things for that too, to try to help. So just be aware that it's out there, and we get the numbness and the tingling and whatnot. So next, CIDP, which is chronic inflammatory demyelinating polyneuropathy. Wow, that's a mouthful. It targets your body's nerves as well. It's inflammation causing damage to the myelin sheath. So again, the myelin sheath is being attacked by your own immune system. Symptoms are, it causes you to be tired all the time, numbness and tingling, pain, causes your reflexes to be slow, weakness in your arms and legs, loss of balance, or inability to walk. You need to have these symptoms for at least 8 weeks, and it's most common in older adults, usually more men than women. So I would question if a doctor tells you that you have this, because usually it's in older adults and usually in men. So basically they're getting this confused for the symptoms that we're having with our fibromyalgia. And if your labs don't show that you have chronic inflammation, then you don't have this because it's an inflammatory problem. The cause is unknown, and you may end up needing a wheelchair if you have this. So here's a little side note. There is a group of genes called the HLA that distinguishes one human from another. So HLA makes you actually susceptible to autoimmune diseases if it runs in your family. All autoimmune diseases have in common is they are caused by genes and environmental factors. So I found that to be kind of interesting. All right, next, psoriasis. It's an autoimmune disease of the skin. It causes red, itchy, scaly patches on your knees, your elbows, your trunk, and your scalp. It goes through cycles of flaring. What triggers it? Infections can trigger it, strep throat, dry, cold weather, sunburns, bug bites, stress, smoking and secondhand smoke, alcohol, blood pressure medications, and anti-malarial drugs. So the anti-malarial drugs are what they give people with lupus sometimes because it helps decrease the viral load if you get exposed to a certain virus, so that it can help your immune system fight that off. And that can actually trigger psoriasis if you have psoriasis. So just keep that in mind if you're taking that drug. Graves' disease, which is another name, hyperthyroid. It's an overproduction of your thyroid hormones caused by your immune system. It's more common in women and people younger than 40. Your symptoms: anxiety, fine tremor of the hands and fingers, heat sensitivity, increased perspiration where you have actually moist skin when you touch it, weight loss. You can get what's called a goiter, which is like a lump on your thyroid gland, and it just makes this big old tumor-looking lump on your neck. It causes bulging eyes. So if you ever see people that have those big wide eyes and it looks like their eyeballs are kind of protruding out a little bit, that's a sign of Graves' disease. Thick red skin on the shins or the top of the feet, and it can cause a rapid heart rate. So what are your risk factors for Graves' disease? Family history, of course, being a woman, your age, less than 40, stress, and smoking can cause this. If it's left untreated, it can cause heart rhythms, irregular heart rhythms, CHF, which is congestive heart failure. It can cause a thyroid storm, which if you have any symptoms of the thyroid storm or all of them, you need to seek medical treatment right away. And that is fevers, sweating profusely, vomiting, diarrhea, can't keep anything down, delirium, where you actually just completely go crazy and that's like not your normal self, seizures. It can cause your blood pressure to drop and you can go into a coma. So if you're having these symptoms, you need to see your doctor right away. It also causes brittle bones because you're not absorbing or getting the proper hormones to keep your bones strong. So that can be a serious one. Now, with fibromyalgia, we have some of these symptoms. We have fine tremor sometimes. We are a little sensitive to either heat or cold. We just have a few here and there. So, that's why you have to get checked to make sure that you have that, or if it's just your fibromyalgia symptoms. I know it's really tough, and it's tough for the doctors too, and that's why a lot of doctors have a hard time diagnosing this, because there are so many factors to consider in trying to figure this out. So Hashimoto's, which another name for that is hypothyroid. It's your underactive thyroid caused by the immune system. Symptoms of that are severe fatigue, sensitivity to cold, constipation, pale dry skin, a puffy face, brittle nails, hair loss, a large tongue where your tongue just gets kind of thick. You can have weight gain, you can have muscle aches, joint pain, excessive or prolonged menstrual bleeding with hyperthyroid. So complications, if it's not treated, you can get the goiter on your neck, you can have heart problems, you can have mental health issues, you can have the coma, and you can also have birth defects. If you have this and you're pregnant, you need to really get it treated because if you're having children, it can cause birth defects. So just be aware of that. Okay, myasthenia gravis is another nerve disorder. It's an error in the transmission of nerve impulses to the muscles. Weakness and rapid fatigue of the muscles. It progresses over a few years. So if you notice that you've been getting some weakness and it's getting worse and worse and you're getting more fatigue and it's just not getting better, it could be myasthenia gravis. So what are the symptoms? Your eye muscles droop, usually your eyelids, and you can have double vision. Your face and throat are impaired. You can have speaking difficulty swallowing, chewing. You can become very tired easily. Facial expressions are kind of like a snarl all the time because the nerves in your face are not allowing you to, smile, or you kind of have that kind of look on your face. And it can be hard to hold your head up because your muscles are so weak, even in your neck, that sometimes it feels like your head weighs 100 pounds. Do we ever feel that with fibromyalgia? Yes, we do. That is one of the symptoms that we have. And we have difficulty swallowing sometimes, difficulty with our chewing sometimes. So we have some of the symptoms, but we don't have the inflammation. Okay, next is vasculitis. Inflammation in the blood vessels caused by your immune system, causing restricted blood flow to tissues and organs. Also sometimes called Kawasaki disease. The symptoms are fevers, headaches, fatigue, weight loss, night sweats, rashes, numbness or weakness. You can get mouth or genital ulcers, blood clots, asthma, skin changes, nerve pain, nasal allergies, scalp tenderness, jaw pain, blurred and double vision, sinus infections, nosebleeds, coughing up blood, abdominal pain after eating, increase in your blood pressure, and you can also get aneurysms because the lining of the blood vessels are being affected, which can cause it to become weaker, so you get an outpouching, which is what causes an aneurysm. It's just your blood vessel becomes weak and it just kind of makes this little bubble on the side of it, and then that can burst, and that's what causes aneurysms. Risk factors, things that can make you more susceptible or make it worse, of course, is smoking, but also hepatitis B or C. If you've ever had either of those, you can be more susceptible to vasculitis. And do we have vasculitis? Well, not with fibromyalgia, but we do have, sometimes we have cold hands and feet because our blood flow is a little bit restricted because of the nerve messages that are coming from our brain. So we can have issues with that without having the actual vasculitis. And a point I want to make here too is that a lot of you on the group sites say, oh, I've just been diagnosed with this, or I've just been diagnosed with that. They're autoimmune diseases, and the thing I want you to remember is that the doctor may be diagnosing you with that, but you really have to look at your labs and make sure they have the proper diagnosis, because just because you have some of the symptoms doesn't mean you have the disease, and they might be getting it confused because they don't know all of the symptoms that fibromyalgia causes. because we have over 200 symptoms. And so it's impossible. And you know, most of our doctors don't even pay attention and don't do the research and have no clue what we're really going through out here. So they're trying to put a name to your symptoms. So please just double check and make sure that, you know, the diagnosis they give you is actually correct. Celiac disease, which is gluten intolerance. When you eat gluten, it triggers the immune system and causes an inflammatory response, which damages the hair-like projections in the small intestines, and this makes it impossible to absorb vitamins and nutrients no matter how much you eat or how many vitamin supplements you take. So the symptoms are diarrhea, fatigue, weight loss, bloating, gas, abdominal pain, and nausea, vomiting. It can lead to anemia from low iron levels, osteoporosis, itchy, blistery skin rashes, mouth ulcers, headaches, and fatigue. Complications it can cause, malnutrition, of course, infertility, miscarriages, lactose intolerance, cancer, nervous system problems, like peripheral neuropathy and seizures. So we, with fibromyalgia, already have peripheral neuropathy issues. We have a few of these symptoms. Some of you already know that you have celiac disease. I have symptoms of this as well, but I was actually checked for it and I do not have celiac disease. Came back negative. So it's just my IBS, irritable gut issues. Okay, so I'm going to stop right there. We're going to do a second video that's going to be attached to this one, like I said, with the rest of the autoimmune diseases, so you can kind of absorb this and go over this. The last thing I wanted to talk about, though, before I go on this video is vitamin D, because I told you I was going to tell you how you can put your autoimmune diseases into remission or have less flare-ups from them. So what is vitamin D? We all know that with fibromyalgia and with autoimmune diseases, we all have low, extremely low vitamin D levels. When mine was first checked, it was 13, which is not even in the range of normal. Normal is 30 to 100. So my levels were so low that I was getting sick all the time. I couldn't fight colds off very easy. They would last for weeks. It plays a huge role with your immune system. So vitamin D, it's known to be related to the regulation of the musculoskeletal system. It affects calcium and phosphate metabolism, and it's related to bone health, right? So what they have found over the research is vitamin D also has a very profound effect on the immune system. It actually affects all of the cell types in your immune system and helps boost them and helps them to function better. So in a sense, it is part of your immune system, a huge part of your immune system. Low vitamin D is directly related to developing autoimmune diseases. Almost everybody who develops autoimmune disease has low vitamin D levels. And let me just tell you right now, with the COVID-19 out there, most of the people that are getting really sick and dying from COVID have low vitamin D levels. So it's directly related to illness. It's been used to treat infections for over 150 years. They treat tuberculosis and autoimmune disorders with it, and they've had success with it for a long time. So, you know, I just want to say vitamin D is so important. Get those levels up. So studies have shown that if you get your vitamin D level between 60 to 100, you will have less flare-ups of your autoimmune, and you may suppress the symptoms. And the way you do that is because you're supporting your immune system and actually helping it to fight back the inflammatory response that your immune system is constantly activating. So it will suppress your symptoms and put it into remission for some time. I mean, you could probably go years without having any flare-ups, as long as you keep your stress levels down, lose weight, get your proper exercise, do your yoga, all that stuff, and get those vitamin D levels up, and wow, you're gonna notice a huge difference. And I'm so excited to be able to tell you that. So that's it for today. So don't forget to click the box and we'll go over the rest of the autoimmune diseases. Bye for now.